Knock the door, knock, knock. Hi, my name is Beza. I'm a nursing student at Presentation College. I'm gonna do head-to-toe assessment today. Is that okay with you?
Yes.
Okay, go out and wash my hand and come back. What is your name?
Brooke,
Date of birth?
December 4, 1980.
Okay, and he's alert and oriented, and by looking at him, he's the grooming and dressing well, and that means the hygiene is kept well. Feel the skin warm, moist, and there's no freckles, something to make me question. There's nothing, and the trigger is normal. That tell me if it's dehydrated or malnourished, and I don't see that. And I'll go ahead and look at the face symmetry, the eyes, everything is normal at this point, and go ahead and start check your head. If you feel uncomfortable or anytime if you feel pain, you let me know. So the hair is dispersed normal, no patching, and no abnormality, no swelling or lesion in the head. Scalp is normal. So I'm going to finish up the head assessment with that and look at the face again for symmetry and feel the maxilla, the sinus. And this is maxillar sinus, temporal sinus. There is no is that a pressure? Okay, no. And then feel the pulse. Pulse is present bilaterally, and then I'll go ahead and open mouth, close side to side, TMJ, checking. Okay, good. And I go look at close look for the eyelash and eyelids, and the hair dispersed normally. There is the eye colors is normal, the cornea, and I look at the eye. The glands, the lacrimal glands, there's no redness, the mucosa is pink. Check both sides. Okay, and then from there, I'll come with, gonna cover your eyes by now. You're gonna read. This is the visual test, and
428365.
okay, this is 20/50. Some people have to wear glass, and I'll ask when I do this test the other eye if they have to wear glass to look at it.
63625.
Okay. Goes to 20/50, the left eyeball, and then gonna hold to that. And next thing I do is the visual field. Okay, cover your eyes with that. And let me know when you feel this is peripheral vision test. Do you see my hand?
Yeah, I see.
One more time.
Yeah, I see.
Okay, switch the hand.
I see. I can see.
Good. Okay. Okay. And I'm gonna test the eye accommodation test. So the eye muscles. Okay, just look my pen, follow your eyes. The eye muscles, okay. Okay. From that, I'm gonna go ahead and do the people reacting for light, and I'm gonna check the other eye. They both react equally constricted to the light. One more to the other eye. Okay, good. And next thing I do is dim the light, and I can look at your eyes inside. This is help me to look your iris Yeah, it's not. Okay. Perfect. I'm looking the orange color. There is no um, blood shaded or nothing in the cornea or inside the iris. At this point, I'll go ahead and check the ears. Any discomfort or discharge from the ears. The outside pinea, there is no lesion, no foreign objects that I can see. And then I'll go ahead and do uh, uh, the whisper test. And I'll go. So I'm going to tell you a word, you will let me know what did I say.
Beza.
Bull,
Ball.
lion.
Lion.
Okay. It is answering good. Then I'll go ahead. This is tuning fork. I'm going to pound it and put it in the middle of your head, and you tell me if you hear the ringing in both sides.
Yes.
Okay. Equally?
Equal.
Okay. Tell me when to stop.
Stops.
Okay. Now the next one I will do, and I'll put, they call it, I'll check your bone and air conductivity by putting this in your mastoid processor back of the ear bone, and you tell me when to stop the ringing.
Stops.
Do you hear them?
Yes. Stops.
Okay. As usual, the bone conductivity is less than the air conductivity. So this is
It's gone. Stops.
okay. For some reason, one ear is. Try it again.
Stops. Stops.
For 45 seconds for air conductivity and 60 seconds for 40 seconds for air conductivity and 37 seconds for bone conductivity. And from that, I'm gonna check it your lymph node, and I'm gonna start from the back, occipital, all the way down here, and posterior aocular, mandibular, submental, superior, cervicular, posterior, cervicular, and truncation. Anterior cervicular, which I don't feel it very well. Those are the one when you have infection, you can feel it very well. And I'm gonna turn your head down this way. Can you swallow for me so I can check your? Same time I can check the thyroid gland. You want this? Turn your in. Swallow for me. Okay. While I'm here, I'm gonna check the tracheal. It's in the middle, and there's no deviation. And I'll go ahead and check your inside your ear. Okay. There is no drainage or foul smell or some foreign object inside the ear. Pull back and go look all inside. What is normal in the ear? The hair is dispersed normally. And there is no normal mucosa. And like that one, and check your nose. When I check the nose, I will start by inspecting from outside as usual. If there's any, I will ask the patient if they have any tenderness or look at for any drainage. Is that hurting? Okay.
No.
Okay, there is no drainage or no swelling. I'm gonna look at your nose. Turn. There is no septum division or polyps. Hairs dispersed normally, pink mucosa. Okay, no drainage from the nose. Okay, and I'm gonna ask you, hold one nose and nostril, breathe. Take a deep breath. The other one. Good. Any difficulty breathing?
No.
Okay. Close your eyes and let me know what you smell.
I smell alcohol.
Okay, close your eyes again. Did you smell anything? Close your eyes.
Yeah, I smell something
Like what?
like bread.
Try again, close your eyes. Boom.
It's coffee.
Yes. Okay, this is cranial number 1. Checked and smell, and then I'm gonna go ahead and look at the TMJ. Open your mouth and close. Okay, good. And then look at for the lips, and then there is no dryness that indicate me dehydration or malnutrition. I'll ask the, there is nothing that going on. Ask you to open your eyes, or mouth, I'm sorry. Good. And stick your tongue out. Ah. Okay, I'm looking for the uvula. The mucus in the mouth is pink. There is no, stick your tongue in the roof. Side to side. Good. When I look at the mouth, I'm looking for the mucosa and the uvula. It's in the middle, +1. If there is any tenderness, swelling, laceration, or discoloration in the mouth and the teeth, and everything looks normal at this point. And I'll go ahead to the neck muscles. Push against. Okay, back, forward. Okay. And at the same time, I'm just looking the trachea. The trachea is symmetrical. It's there is nothing deviated. The chest, and I'm looking for to feel out the pulse. Jugular. I can feel the pulse. I'm looking for the if any pounding or something abnormal, swelling, distended jugular vein, which I don't see, and I'll oscillate with the bill of my stethoscope. If there is any stenosis or fluid overloaded, I can hear from listening the jugular vein, which I don't hear at this point, but I can hear strong pulse, which is good. And from the neck, I'll go to the chest, and from the chest, I'm looking for rhythm, symmetrical, and the breathing pattern. If this person using axillary method, or if this person has deviated trachea, that even tell me the way they're breathing. So striker shoulder. Okay, one more. Okay, so the chest is symmetrical, and I'm gonna go ahead and listen for the lung sound and heart. Okay, so at the same time I'll go to aortic valve, pulmonic valve, and listen S1 and S2. My cuspid valve. I don't hear any S3 sound, and I'm gonna go ahead and check for pulse at the same time. Radial and brachial pulse, both present strong pulse, and I'm gonna go ahead and check the other hand. Same thing, brachial and radial pulse. And I'll go ahead and take 1 minute pulse, counting manually. Heart rate 72. So I'm gonna go ahead and ask the person if the resistance. Go ahead and put your hand up. Can you see me push it? Do like this. Okay. Any muscle deformities, any hamstrings. Check the muscles, there's nothing. And I'm gonna turn them and listen their lung sound. Okay. First thing before I listen, I'm looking the symmetry of the back muscle. If there's any drooping in one side or hunchback, whatever it is, I have to look at before, or bulging, if in the spine, and if any tenderness when I touch it, will you let me know? Okay, and I'm gonna escalate the lung sound. Can you take a deep breath for me? One more. Okay. All right, and I'm gonna turn you towards the camera so we can do the tactile. Okay. Can you say 99?
99.
One more.
99. 99. 99.
This is the tactile, I'm just feeling it. And one more time.
99.
Okay. I'm gonna go ahead and check for CVA in the side. Let me know if it's hurting. This is if any abnormal infection. Does it hurt?
No, that hurts.
Any abnormal infection in the kidney, and there's nothing going on. And I'll go ahead and precursor this time. This will tell me if there's any fluid in the lungs. I check the breathing pattern. Everything's good, and we turn around, and at this point we're gonna go ahead and ask my patient to close his eyes, close your eyes, and I'll do the sensation check. I'm gonna give you object and you tell me what's in your hand. Open your hand. What is in your hand?
The coin.
Yes. Okay, close your eyes. So you tell me if you feel like sharp touch or soft.
Soft. Sharp.
Good.
Sharp. Sharp. Soft.
Good. You can open your eyes. This is checking the sensation. It's still sensation. And the other way to check the sensation is use the vibration and close your eyes if you feel. What did you feel the vibrating?
I feel the vibration.
Okay.
Yeah, vibration.
Okay. And I do that. And next thing I do is I'll ask if the person have any kind of injury, and if they can touch their fingers. Can you do this? Touch all your fingers. Okay. And can you bend wrist side to side waving? This is all the sign if someone has previous injury or stroke. Close the arm. Can you reach the other hand? Like yourself. Good. And the bicep muscles, if you can, and the other one. And I just check the strength. So it's good. So if people have some kind of injury, they cannot do that unless we do assessment. There's no, okay, push against me. There is no way I can tell, so that is done. Next thing I want to do is I'm going to feel the abdomen. So we're going to go ahead and lay down on that couch. Okay. The first thing we do with the abdomen is we looked at the skin, the color of the skin, and the symmetry, if there's any, if the person have hernia, if the person has any bulging spot or pain, you will ask them before you touch them. If any spot you feel like sensitive or something,
No.
okay. Then I will ask first, I will listen, because if I touch it, the vowel sound will change. So I'll listen the 4 quadrant for 5 minutes with my stethoscope. Oh gosh. Okay, I'll start from the lower quadrant. And the upper quadrant. Vowel sound present. There is no indication for vowel obstruction, high pitch sound, or something like that, or it's active vowel sound, as which I expect it's active. Or if there is no vowel sound, which tells me the iliac. Okay, vowel sound is present. Next thing I will do is I look the umbilical has to be symmetrical, which I checked it when I check it, and the next thing I do in the abdomen is lightly press it. If there is any discomfort, I have to stop, because there might be hernia, they might have stenosis, so there is no discomfort. Then the next I will do is press it a little bit deeper so I can feel the organs. If there is any bulging spot or any discomfort, then I can feel the organs by depressing a little bit harder. And after that, I will, each quadrant I will percussionate. This tell me if there is any fluid or swelling in the abdomen or tumors going on. The abdomen sound will change. Then after that, and after that I'll go back to the femoral artery pulse, which is right here in the groin. I'll feel it. Of course, see where this kind of pants, it's hard to feel it, but it will be femoral artery all the way down here. And then I'll come back down here in pontile. I'll feel on both sides. Present. Under the sacks, it will be tibial. Present. Try to feel on top of the taxpedial pulse. Which is present for both. And since this is a gentleman, I have to teach him about testicular exam, self-exam, every month at the same time, preferably in the shower in warm water. You feel your testicles. If there's any swelling or discharge, something that you don't, you haven't seen it before, you have to report for a provider. If it's a female person, I'll tell her to do self-breast exam every month, preferably at the same time. Lift up your hands and starting from the back of your arm all the way, feel your breast tissues, and if you feel anything, swelling, tenderness, or discharge, or something you haven't experienced before, you have to tell for your provider. And then we can sit over here. Please. Last thing I wanted to check is reflex. So I'll start from up to the bottom. Okay, go ahead and go behind the arm. Okay, and go for the legs. Good. Okay. I'll ask the person if he can cross the leg. And can you draw number 8 in your leg? Like this? No, I'm only. Yeah, that is accomplish our abduction. Abduction to the same thing. And draw number 8. Like this. Can you extend your foot and back? Okay, same thing the other leg. Okay, pull it against me. Okay, push back. Okay, and then last thing is for the foot. Pull back. Good. Okay. And as usual, I will ask the foot to go back and forth. If there is any discomfort, the person will tell me, and I will stop there. It will tell me that there must be injury of muscle or something that he doesn't know it, and I'll feel the muscle. I will start as usual by looking at it. If there's any abnormality in the person's leg or thigh, and I'll ask them if they have any kind of surgery or injury before, that I will aware of it. At this point, I assume this person doesn't have any injury, and I will feel any swelling, tenderness. You feel okay?
Yep, I feel okay.
Okay. And the whole leg feels fine, and he doesn't have previous injury. And I'll ask you to walk with me towards the camera so we can do the regular test. I'll show you how we walk. Okay, toe to toe. And this is when the person walks like this, I'll stand behind him, check the gait, the balance, the spine. And still I'm working with the muscle groups. So when can this person keep the balance? Can they walk normal? And that's kind of things I'm looking for. And with that, um, I'm gonna conclude my assessment. Do you have any question for me?
I have no question.
Okay, thank you so much.